Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. I'm Miss Ma'alina Idris under the supervision of Dr. Siti Khadijah binti Qasim. I'll be presenting about one of my client issue that are related to intrapersonal issue. So this is the contents outline. Talking about the counselling side, I've done my practicum in Sekolah Menengah Tengku Panglima Perang Tengku Muhammad. What's unique about the school is it is located in the middle township where students come from various socio-economic backgrounds. There are 3 counsellors and two of them are certified counsellors. I categorize my case as intrapersonal, related to anxiety, and then interpersonal that involve relationship. The counselling type is enrichment, which I help the client in building her character. Theoretical orientation, my most common theory throughout the session is reality therapy. It helps clients take more control of their life and to help them connected with people that satisfies them in their own quality work. Fortunately, in my client case, I've been using the same reality therapy. The WDEP system, client is given full authority to choose what issue she wanted to resolve, and then client is assisted to choose her own destiny, to change her behavior, to create her own quality work. Okay, identifying information, SAM0421F is 15 years old. She is Form 3 Abadi, which is the first class out of 8 classes. When I first saw her during my sit-in, I noticed that she behaved in a bit peculiar way, where I often seen her wrap her arms over the body and wasn't bothered with others. She is a Muslim and Malay by race. Her current class rank is 18th from 30 students. She is the third child out of 4. She has 2 elder sisters and 1 youngest brother. Her second sister was a special needs student at the similar school before, and then they are currently living with their both parents in double-story house. She comes from upper middle SES. Her house is so close to the school. Okay, during my sit-in, I conducted the SSKM test for the students, and I saw her answer for item 13. I did ask her whether she understands the question or not, and I encouraged her to come to see me for sharing. And the 13th April marked the first session I had with her. So this is biopsychosocial history of presenting problem. She has involved in a non-tragic car accident in 2016. Family history, her sister is having learning disability due to jaundice, and then intrapersonal, she developed an over-exaggerate fear towards her condition, family and environment. Interpersonal, she disengaged from her friends and often having irrational belief towards them. Counseling history, she underwent many counseling sessions, and the last session she has been is when she has to answer the DAS test. Okay, presenting problem. She's having problem with her intrapersonal, where she started believe DAS score was true and she affected by the anxiety. And then I found that it is related to her experience in car accident. She started to isolate herself and less engaged in class, where this thing also sparked the problem with her mother, and then she attempted to hurt herself. So she has been to 6 sessions with me in these past 3 months. So the treatment, the assessment of the case diagnosis, I've been using SSKM, Woolley SBKK or self-compassion scale, G87, PHQ9, and the no pain scale, this one. clinical interview observation. In referring to the PTSD, I've been using the SM5, where I found that criterion 4 in PTSD is showing the same symptom as she is. Academic result, 18 from 30 students. Okay, assessment of the case about mental status exam. She had irrational belief, irrational thinking on the cognitive and emotional, always looks sad and irritable, being irritable. And then her behavior, if you can see, she always bring her handkerchief and never wear off her mask during the session. She also tend to do the abnormal movement, like repetitive movement with no purpose. Okay, this is the issue identified. Treatment goals to help clients self-examine and confront fear, other past experience, to help client the attempt to non-suicidal self-injury, to guide client works on her attitude to good relationship with her mother, and then to assist client to control her irrational fear and increase her self-confidence to achieve her goal. Okay, so I've been done 6 sessions with her. Okay, as you can see, the treatment intervention, I've been using exposure therapy, which is graded exposure for the first issue, and then dialectical behavior therapy for the self-injury attempt, and then MP chair for the communication issue, and then reality therapy for the fourth issue. The first illustration, the first issue, the PTSD, I've been conducted this exposure therapy in second and third session. As you can see, the pyramid show that these are the rank of the fear events that I've been test to her, and Alhamdulillah, client learn response incompatibility with the fear, where she didn't express any avoidance, and then her facial expression were being examined throughout the session. Okay. This is the illustration of the second intervention regarding to non-suicidal self-injury. I've been using dialectical behavior. Client is taught to change her behavior while instilling the self-acceptance within herself and her current condition. So as you can see the result, the client started to, she's no longer doing the self-harm. Okay. So illustration of the third intervention regarding to the relationship problem, I've been using empty chair. I wanted to assist her to change her attitude and emotion about her mother and learn how to build a good relationship with mother. From the session, I realized that the client did mention her program with her mother in the fourth session, that she has already communicated with her mother, but then she still can't accept her mother's treatment toward her. Okay, so next, the last illustration of the intervention 4 regarding to anxiety. I've been done this in session 5 and session 4 and 5. Okay, so this WDEP is aimed to assist client to control her irrational fear and increase her self-confidence to achieve quality work. So the observation, client in the third session mentioned that she won't join online class during the past total lockdown. So by far, I've been collected and evidence from the teachers said that she has joined the online classes as and Alhamdulillah, this WDP has changed her behavior. For the fourth intervention, actually, okay, let's see illustration. Okay, so for the first in the fourth session, client been applied the W1 and direction. She wants to gain self-confidence, and then the direction promised to participate in class, and then she has to work on her attitude. And the fifth session, we evaluate her evaluation, her want, and then she stated her plan as follows. As you can see, to occupy herself with some study skills to avoid her irrational thoughts effectively. Okay, in the last session, which is the sixth session, I've been sharing with her about the study skill in helping her uh, to easily adapt with online class. So this is the case termination. We have six session until 9th of June. The client already achieved all of her goal, and then the session is terminated. Okay. I've been conducted self-compassion skill to the client. Okay. As you can see, her score is 3.52, which is high and indicated that she has high self-compassion. Okay, my reflection is this client really taught me to prepare myself with all the competencies needed in the helping profession. Truth be told, I don't think this organization or this session was successfully uh, organized. And then I think that they are this area that I need to improve, which is application of the theory to practice, and then emotional stability and also self-control. Conclusion, this case presentation has fully broadened my knowledge and increased my self-assessment. Apart from that, I realized that we need to practice the theories and techniques by doing role play and case study to help me becoming more competent and well-organized counselor. Okay, finally, to be a competent counselor, we always need to look up for supervisors and senior counselor to consult and ask for suggestion or opinion. So these are the references. This is the family genogram. I've been done with her in in the second session when she turned up with her relationship problem with her mother. This is the case conceptual to like give details in this session. And then, so this is the worksheet, REBT worksheet and WDT worksheet. As you can see, that one, the conversation between me and the teacher, the class teacher, saying that she's joining the online classes. Alhamdulillah. Okay, thank you. Assalamualaikum.